Hi. So, if you're a first time viewer, I am Dr. Wajahat and I basically teach anatomy. So, the reason of this YouTube channel is to make anatomy easy for you guys, for whoever is watching. It could be a student, it could be a resident, it could be a clinician, it could be just a random person scrolling through YouTube and just saw the thumbnail, decided to watch the video. Anyway, so today we're going to talk about the muscles of facial expressions and the muscles that make you smile or frown depending on your mood. So all the muscles of facial expressions, all of the things happening over here. So any expression that we make, so it could be like, so all these expressions, they basically happen because of our muscles of facial expressions. So what is the anatomy behind that? What makes us smile? What makes us sad? What makes us frown? What makes us worried? So we're going to talk about all of that. Uh, Before we begin, we need to know that how muscles of facial expressions are unique, how they are different from the rest of the muscles in our body. So, if you are a medical student and if you've studied anatomy, you would have probably studied that most of the muscles they are in a specific layer, right? So, in your body, we have specific layers. We have a layer that is only comprised of epithelium, connective tissue, and then we might have muscles deep inside. But the muscles of facial expressions are unique in the sense, just like every other muscles, they have two attachments. So one is a proximal attachment, formerly known as origin point, but we don't use that term anymore in anatomy. So proximal attachment and distal attachment or insertion, formerly known as. So the proximal attachment of the muscles of facial expressions that occurs in the subcutaneous layer of your body. So skin is basically, made up of a lot of things, and after skin we have a lot of other layers, and one of those layers is subcutaneous layers beneath your skin. So that's where these muscles originate from. And where do they insert? They insert then onto the skin of your face. Rest of the muscles don't do that. Rest of the muscles just originate either from bone and then insert on a bone, or originate from subcutaneous tissue and insert on the bone or in another subcutaneous tissue. But the facial muscles, they originate from the bone or the subcutaneous tissues and then insert directly onto the skin. That's why they function so easily, or their function is so visible to us, because it's happening right beneath the skin of the face. Embryology. So, what could we talk about embryology? We need to know that what is the reason that only one nerve innervates all of these muscles, and that's because these muscles originate from the second pharyngeal arch. So, during embryology, we have certain, pouches, arches, certain crevices that are being formed when we are being formed. So the pharyngeal arches, we have a number of them. So the second pharyngeal arch gives rise to these muscles of facial expressions. And just like each arch has its specific nerve supply, the pharyngeal arch, the second one, has facial nerve as its chief nerve or its only nerve. So whatever arises from this pharyngeal arch would be innervated by the facial nerve, that is your cranial nerve 7th. So muscles of facial expressions originate from that arch, hence makes sense why facial nerve would supply these muscles. Anyway, let's talk about, we have numerous muscles of facial expressions as you can see on this model, and we're going to identify them, and then we're going to talk about most of their functions, right? So let me just bring this closer to you guys, because again, this channel is right now at its embryological stage, no pun intended. So I don't know how this is going to look, how the editing is going to be, but let's see what happens, right? Anyway, so we have these muscles over here, right? So the first muscle that you can see is this muscle, the first muscle of facial expression. This is called the frontalis muscle, right? So it's a part of a whole muscle that is ranging from the front of the skull to the back of the skull. Its name is fronto-occipitalis, sensibly named. So the muscle Among these two that takes part in facial expressions is only this muscle. So that is called the frontalis muscle. As you can see that this is originating from the bone, frontal bone, and then it's going to insert onto the skin of the forehead. So when I teach my students, I teach them that the function can easily be guessed or easily be deduced because one of the points of the muscle is going to be fixed and the other point is going to be movable. So obviously when the muscle contracts, the fixed point is not going to move towards the movable part. Instead, the movable part is going to be pulled towards the fixed part. So in this case, this muscle is going to contract and this is going to pull your forehead upwards. That means that this muscle is going to work when you're supposed to do this. So the wrinkling on the forehead, this wrinkling on the forehead is being caused by frontalis muscle. Then the second muscle we have is this muscle over here, this muscle. And this is called corrugator supercilii. Sensibly named if you know your words and your terminology. So corrugator, that in some language, probably Latin or Greek, because anatomy is like derived from that language, most of the terms. So corrugator means to corrugate or to converge. And supercilii means that cilia, hair. So this is the muscle that is concerned with moving your eyebrows. So this muscle, because it's going to originate from the medial aspect of the orbit and going to insert onto the skin over here. So when it contracts, it's going to pull the eyebrows medially, right? So it's going to make your face look somewhat like this. So this is an expression of worry, of concern. I am concerned whether my channel is going to blow up. I'm concerned whether this is going to help the students. So this is me being concerned. Then we have the most easy of the muscles, and that is this muscle over here. Because it's around the eye, what is another name for the word eye in anatomy? It's oculi. You can also remember this by a movie, a horror movie. It was called Oculus, and it was a pretty good movie, and it had something to do with the eye. So if anybody is a fan of that movie, they can easily remember this muscle because people usually get confused between orbicularis oculi and orbicularis oris. So the word oculi, it means eye. So this muscle over here is called the orbicularis oculi, and it has three parts. So the part that you see over here, the round big part, this is called the orbital part of the orbicularis oculi. Sensibly named because this is the orbit formed by multiple facial bones. Then we have a part of this muscle that covers the eyelids. So we know that we have two eyelids. So we have the upper eyelid and then we have this lower eyelid, right? So these parts are called palpebral part of the orbicularis oculi. And then there is a third part that's called the lacrimal part of the orbicularis oculi, and that's named Y because it would have something to do with lacrimation. That's tears, related to tears. So that's a muscle that is going to squeeze the tears out of the lacrimal gland. So it's deep inside and you can't see it over here, but we have three parts for theoretical purposes. The one you can see on this model are orbicularis oculi orbital part and then the palpebral parts. Then we have, okay, so we have these two muscles over here. So one is this muscle. I don't know if you can see this because I can see what I'm showing in my mobile phone. And then we have this muscle over here. This muscle, as you can see, it's originating from the zygomatic arch. And this muscle over here, it's going to originate a little from the zygomatic bone that is deep inside this muscle and a little bit from the maxilla's inferior part. And you can see that this muscle is going more towards the upper lip, while this muscle is going more towards the angle of the mouth or the corner of the mouth. Because this muscle is going to originate from the zygomatic bone or zygomatic arch, and it's going to be bigger than this muscle and has a major role to play when you smile, this muscle is called zygomaticus major, sensibly named. If you know that this is the zygomatic arch, you can deduce the name that this would probably be zygomaticus related name, and this is zygomaticus major. So you can see it's going to insert around the angle of the mouth. So when they act bilaterally, so it's going to cause for you to smile. So this is also called the smiling muscle or the muscle of smile. So if somebody asks you that what is the primary muscle that makes you smile or the muscle of smiling, so its name should be zygomaticus major. A lot of other muscles take part in making a person smile, but the chief muscle is this muscle, zygomaticus major, right? Then we have this muscle, and this is called zygomaticus minor because it's not originating mainly from the zygomatic bone. It's originating from two bones, and then it's a smaller muscle, so zygomaticus minor over here. Minor, major. So as you can see, that minor is going to insert onto the upper lip. So it won't really take part for a person to smile because it's supposed to be from the corner of the mouth. But this muscle, when it acts, it helps to move the lip upwards or helps to evert it, right? So it's going to be caused when you are sad. So right now, because my lip is curling upwards, that's eversion. So that's being caused mainly by zygomaticus minor. But what happens when zygomaticus minor and zygomaticus major, they act together but only on one side, only unilaterally. And that would make a person show disgust and disdain. So let me try that. So this right here, this is zygomaticus major and zygomaticus minor. So again, when you show expressions or when you express an emotion, it's not only one muscle that's being, that's playing a part. It's multiple muscles. So if I want to show disgust, I would probably make a face like. So a lot of muscles are going over here that are acting, and zygomaticus major and zygomaticus minor are acting on this part to make me do this. I can only do this on one part. I don't know why I can do this on the other. But fun fact, if you practice, you can probably do it on both sides. Okay, so I just turned on the lights over here. Hopefully the lighting is better. And I wanted to check that whether I was recording everything correctly because again, initial embryological stage of this channel, and I can really see what I'm teaching or what I'm showing to you guys. So everything is going smoothly for now, except for the lighting. I look hideous, but that don't matter as long as you understand this. Okay, so if we move on to, let me just remove this table, and hopefully this is going to help you. Okay, now we talked about zygomaticus major, we talked about zygomaticus minor, right, over here. Now we're going to talk about, let's talk about the muscles of the nose. So this muscle that you can see over here, this is called nasalis, sensibly named again. So the names of these muscles are relatively easy because if you just know their names, right? If you don't even remember where they are located, just by their names, you're probably going to guess the answer correctly. So that's why I usually tell the meanings of these words so that whenever you see these words in your exam, in your OSPE, hear them in your YY, you're probably going to guess the answer correctly. Anyway, so we have this muscle over here. This is called nasalis. Now nasalis also has two parts. Just like orbicularis had three parts, this also has multiple parts and basically two parts. So the part that you can see over here, that is going to range from one side of the nose to the other side of the nose, just like a bridge. This is called the transverse part of the nasalis muscle, right? So if you guess that when it's going to contract on both the sides, this is going to close your ears or your nostrils or your nasal or your airway, nasal airway, or stuff like that. Multiple words, same meaning. Again, then we have another muscle, part of this muscle, that's called the LR part of the nasalis muscle. You cannot see that because of the other muscles and other things going on this model. but it's deep inside, right at this part of the nose. This is called the ala of the nose. So that muscle is going to range from the ala of the nose and insert onto the skin above the lateral incisor. So that's somewhere around here. And if one muscle is going to close the ears or the nostrils, the other muscle is obviously going to open them. So it's the LR part of the nasalis muscle that's going to open the nostrils, that's going to flare your nostrils, flare your nares. So a lot of people have control on this, just like me. So I have the superpower. So if you can move your nostrils voluntarily, like doing this in the camera looks so foolish, but hopefully it makes you understand. So the reason I could do that is because of the LR part of the nasalis muscle. Okay, then we have, let's talk about this muscle over here. So we have this muscle, and then we also have this muscle over here. This was zygomaticus minor, but if you can see that this is being divided over here by this line. So this muscle is different, and then this muscle is different. The muscle between the nasalis muscle and zygomaticus minor. And then the other muscle between the zygomaticus major and the zygomaticus minor. So if you look at this muscle, this is going towards the angle of the mouth. If you can see its fibers. So this muscle is going towards the angle of the mouth, and it's coming from above, right? And it's going, if it acts, it's going to elevate the angle of the mouth. And hence why this muscle's name is levator anguli oris. Sensibly named, easy to remember. Levator because it's going to elevate. It's going to elevate what? Anguli oris. Oris refers to mouth. Anguli is Latin or Greek for angle. So it's going to elevate the angle of the mouth. So this muscle over here, this is levator anguli oris. Now what should be the name of this muscle? This is also coming from above, from the inferior part of the orbit or the maxilla bone, and then inserting onto the skin of the upper lip over here. So because this is also coming from above, it's also going to elevate, and it's going to elevate the lip. What is another name for the lip? It's labii. So this muscle over here is going to be called as levator labii superioris. Now why did we feel the need to add the word superioris? Is because angle of the mouth is just one structure. Like we don't have a lateral or a medial or a superior or an inferior angle of the mouth. But we do have two lips, and there's a muscle that is acting on the upper lip, and then there's another muscle that is acting on the lower lip. So that's why to differentiate between these two, their name has levator labii superioris. And again, levator anguli oris, you guessed it correctly, it's going to do what? It's going to help you to smile, right? But the main muscle is going to be zygomaticus major, but it's also going to be a muscle that's going to aid zygomaticus major in order for a person to smile. While levator labii superioris, that's going to do what zygomaticus minor was doing. So it's going to evert the lip, right? So it's going to make you pout, it's going to make you sad. So this movement over here, this is being caused by zygomaticus minor and levator labii superioris. Then we have one of the funniest named muscles, and that is this muscle over here. I don't know if you can see this in the camera, but again, this is the transverse part of nasalis. Then we can see that there is a muscle that is diverging from the fibers of this muscle over here, between orbicularis oculi and nasalis. This is called, so this muscle over here, this muscle, because it's ranging all the way from the nose or the nasal area and then all the way towards the upper lip. So in anatomy, you probably would guess that its name should have both of these points, right? A nasal point and the upper lip. So this muscle over here, its name is going to be levator labii superioris alac nasi. That is a mouthful. But you can remember that levator labii superioris, that refers to the lip part. Alec nasai. Now, I don't know what the word alec means. You can search it up. I don't remember. But nasai means nose. So this muscle has both of these names because it's coming from both of these areas. Then we have this muscle around the mouth. Just like this was orbicularis oculi, orbicularis because it's round and the word orbicularis means round. This is orbicularis oris because round muscle around the mouth. So this muscle over here, the fibers that are going just like a sphincter, circular muscle all around the mouth, this is called the orbicularis oculi. Now this is the muscle that's going to help you, your lips, to be forced in or to be compressed in. So when you purse your lips like, or wait, let me do that. So this muscle that's going to invert your lip or is going to force your lip towards your teeth, this muscle is going to be orbicularis oris, not oculi because that's the muscle of the eye. Orbicularis oris, that is the muscle of the mouth and helps you to close your mouth. That is the main function. Got to do this quick because there are a lot of muscles and this video is already, I don't know, 20 minutes long. So we have some of these lower muscles over here. We have a muscle that is going towards the angle of the mouth inferiorly. Then we have a muscle that is going towards the lower lip. And then we have a muscle that is towards the center or the median plane. So these three muscles are sensibly named. This muscle over here that is inferiorly and is going towards the angle of the mouth, guess its name. You probably guessed it right. Because this muscle or these muscles were elevating, this muscle is going to depress. So this muscle is going to be called as depressor anguli oris. And this is the muscle that when acting bilaterally is going to make you frown or make you sad. So I'm sad that this video is so long. Hopefully you guys will love it. Then we have this muscle because again it's going from the inferior part of the mandible towards the lower lip. It's going to be named as depressor labii inferioris. Makes sense. So sometimes people get confused that they mix it up, like they add levator anguli superioris or depressor anguli inferioris. But we don't need that because again, angle of the mouth is just one structure. It doesn't need to be superior or it doesn't need to be differentiated between superior, inferior, medial, lateral or any of those terms. But we have two lips, an upper lip and a lower lip, and two separate muscles acting on these separate lips. So the upper muscle, levator labii superioris, the lower muscle, depressor labii inferioris. So it's going to make the lower lip evert, again causing sadness or pouting. So if I were to pout or if I were to be sad, my levator labii superioris is also going to act and depressor labii inferioris is also going to act for my lips to be everted. So, right? So this. So puppy dog face. Yeah, puppy dog face. These muscles cause the puppy dog face. Just remembered. Anyway, this muscle over here, this is going to be called mentalis, right? Mentalis. Because we have the mental spines over here on the mandible, right? So it's going to be called mentalis, and it's also going to do the same thing as depressor labii inferioris. It's going to pull the lower lip downwards and help it to evert as well. We're left with two muscles, I think. This muscle over here, this is one of the main muscles of facial expressions, and this is a very deep muscle. So there's a muscle on top of it that's cut over here to show you this deep muscle. This deep muscle is called the buccinator. The buccinator, sensibly named because it's going to be around the buccal area and has to do with your cheeks. So buccinator muscle over here, when it contracts, it's going to pull the cheeks inward, right? So along with orbicularis oris, I was about to say oculi, oris is going to press your lips against the teeth. So when you have a bolus in your mouth or when you're chewing, it helps for that bolus to stay in the arch of your teeth and it helps you to chew. It doesn't, if these won't function, the bolus would probably be squeezed into the cheeks or flow into the cheeks and they won't be grinded by the teeth, upper teeth and lower teeth. So orbicularis oris, along with buccinator, helps in chewing. It helps in certain, all of these muscles help in phonation, by the way, especially the ones around the mouth. So this is also going to help in phonation. But more importantly, when you blow something, so when you blow um, an instrument, an air instrument, wind instrument, sorry, a wind instrument, so like a fluid or a trumpet, or when you're, blowing, when you're blowing a balloon. So the muscle acting, because this comes as a BCQ or as a question, that what is the muscle acting when a person is blowing a balloon or when they're blowing candles. So it's buccinator mainly, and then the orbicularis oris as well, but buccinator should be the main answer. We have this cut muscle, so quickly I'm going to name it. It's named as rhizorius. Rhizorius is going to be the superficial muscle, and buccinator is going to be the deeper muscle. Buccinator has three fibers, by the way. It's a big muscle. The fibers are going to go towards the upper lip, deep inside, the lower lip, and even inside the mouth at a thing called pterygomandibular raphe. But that's a topic for another day. This superficial muscle at the angle of the mouth is called as rhizorius, and it originates, or it comes from the parotid gland's sheet, parotid sheet. So parotid gland should be somewhere over here, and this muscle connects to its sheet, right? And it's also going to act to depress the corners of the mouth, causing a person to frown. Okay, I think we're done with all the muscles over here. One thing more though, there's a point over here, and it's called the modulus, right? So the modulus is a point where 9 of these muscles, the muscles of the mouth, especially the corner of the mouth, just like spokes of a wheel, so they sort of converge onto the center point over here. So that's called the modulus. Um, this muscle is temporalis. This is not the muscle of facial expressions. Don't get confused, because people mistake this muscle as the muscle of facial expression as well, but it's not, because it's another completely different muscle innervated by completely different nerve doing completely different thing. There's we're not done yet. There's a muscle deep inside, very deep inside, just below the nostrils, or this part. This is called the philtrum of the lip, right? So it's called the depressor septi nasi, and as its name suggests, it's going to depress the nares, and in doing so, it's going to act with the LR part of the nasalis muscle to open the nostrils or the nares. So when the nostrils are going to be pulled downwards, like you can see that my nostrils got opened. So this muscle is depressor septi nasi. I think we're done with all of this. Whew! Finally. So I hope this video helped you. It's 30 minutes long, but it's worth watching. We have 3 models over here, and I can't show these muscles on each of these models because it's going to take time, but they were very easily identifiable on this model, and you can translate these muscles on these models as well. The nerve supply, the facial nerve supplies these muscles and the branches of the facial nerves. You can check that from the book, because this video is already way too long. So it has 5 branches, main branches, the facial nerve, terminal branches. It has more branches, but 5 terminal branches that emerge from the parotid gland, and they somehow make an arrangement like this, right? So my thumb is going to be called the temporal branch of the facial nerve, because it's going to the temple region. This branch over here, this is going to be called as the zygomatic branch over here, right? Then we have this middle finger branch. This middle finger is going to be called the buccal branch. This ring finger is going to be called as the marginal mandibular branch, because it's going around the margin of the mandible. And then my pinky finger is going to be called as the cervical branch, right? So again, look up what these nerves innervate. These nerves would innervate all the muscles of facial expressions. One important thing is that the orbicularis oculi, because it's a round muscle, 2 nerves innervate it. One innervates the superior part of the orbicularis oculi as well as the superior palpebral part. So that is going to be the temporal nerve, right? It's a branch of the facial nerve. And the this nerve, yeah, zygomatic is going to innervate the inferior part of the orbicularis oculi, or the lower eyelid, or the lower palpebral part. So this is an important point that usually examiners ask students, that this muscle is innervated by two nerves. So what happens when this nerve fails, or this nerve gets damaged? Muscles of facial expressions get paralyzed. And usually because gravity acts on these muscles, and these muscles, if it's affected on one side, they won't act to maintain their tone and to pull the muscles. So there's going to be drooping of these muscles, drooping of the eyelid, drooping of the lower of the lip or the angle of the mouth. And because of this drooping of the eyelid, because the tears are going to flow and they're not going to be spread over the eye, they're going to accumulate in the corner of the eye. They're going to probably drop down or dribble down along with the saliva from the corner of the mouth. So these are going to be the symptoms or clinical signs of a person having facial muscle paralysis. So if it's going to be on one side of the face, the person is not going to be able to wrinkle this part of their forehead. They're not going to be able to flare this part of their nostrils, not going to be able to smile on this part of the angle of the mouth, and the eyelid is going to be drooped downwards. There we have it. We're finally done. Hopefully this might help the audio this time. Just have to do something about the video now. Cheers.